This past reading week, a group of interprofessional students and doctors and members of our team in Guatemala were able to work together to see over 375 children on this immersion experience. The students were able to do a variety of things, including health assessments, many health assessments, working alongside with the pediatricians and the GP, and working with the children in both rural and urban communities.
Our day kind of started really early in the mornings to set up the medical clinic with the medications and the stuff we had. So throughout the day, it was like a mini emerge where children will come and we will call their names, and there were different sections where some of the students were assigned to give medication administration, whereas others did more of the health assessment part, gather history, and then some of them were paired with doctors, so giving medications and also doing health history and health examinations with the doctor, and also finding out which are the students that are high risk and they need more care.
When we went into some of the rural communities, there was another dialect, so we had two interpreters, one from English to Spanish, then Spanish to their own language. So just that kind of relay between the different languages was probably the most difficult. When you're in the zone, you really don't think about it, so a lot of like the sexual assault and that sort of thing, it hits you after the fact, right? And we also went to the Guatemalan dump and kind of seeing how some of them lived. They lived among some of the garbage there, and they lived off of the garbage of some of the wealthier people. And when you're kind of there and helping the children, you didn't really think about it, but it was after the fact that you really kind of sat back and understood.
This is a unique opportunity for our Humber students to immerse themselves in another culture, as well as to learn about healthcare in a developing country and to work collaboratively on an interprofessional team. So this year we had practical nursing students, paramedic students and Bachelor of Nursing students, as well as two pediatricians and a GP. But what's important to remember also is that we also have a team in Guatemala, and we've developed that relationship over the years, over the last 3 years that we've been going. So we had the opportunity to work with one of the doctors who cares for the children at Valle de los Angeles, as well as working together with community leaders, especially with the indigenous population in Solula. So that was really developed, and they were so happy to see us again, and we know that we made a positive impact.
I think it was a really good experience to work with the team because when you're working together from a different health professionals, you get to learn about their scope of practice, and in the end you all work as one unit.
It's nice to see that Humber College is us continuously going down. We're seeing a trend towards these children being healthier. I think the biggest thing that surprised me was the poverty there. Frankie talked about it quite a bit before in some of our pre-departure meetings and some of the cultural norms, and I think that was the biggest culture shock for me, is the second we drove in, you could turn left to the equestrian club and then right to one of the red zones, and just seeing the difference in populations there. They don't have any of the middle class. They have people who have quite a bit of money, and then people who have no money at all, they call them squatters. They just kind of set up a shack wherever they possibly can, and I think that was the hardest part for me, is just seeing that poverty. And you kind of have to step back and think about some of the things that they go through, and it's quite different than the things that we go through every day. So you kind of had to look in their perspective. I think that was the biggest thing about cultural humility, is that you don't want to judge anything that they're doing, because everything they're doing is for a specific reason. It's their beliefs and their cultures are different than ours. So I think that was the whole thing going in. We kind of had to have an open mind, imposing no judgment whatsoever, but also just being able to help in whatever way we possibly can.
All of us had a really positive impact. And most of us, when we were doing the reflections, we said it changed our life in a way that, just for myself, I think you take so much in your life as granted. So when you go there and you see people and you see how much less they have, and they're happy and they're willing to give and share of whatever they have, it just gives you real happiness. So I think it was a real positive impact, and for me it affirmed that I wanted to do this for the rest of my life and be a nurse.
These people loved us. Every time that we would actually drive the bus into these communities, they'd all stop and stare and be waving at us. And you'd never see that here, really, right? So it's really cool. And when we pull up into the community, all these kids would run and just give each of us a hug.
As a teacher in the Bachelor of Nursing program, of course, my focus tends to be the learning of my students. But with this particular immersion experience, for me it's a balance. I want to make sure that my students are learning, but also our priority has to be the children that we're caring for. And I really think that we were able to balance it well. And I think from the feedback from the students, they learned a lot, but they also felt that they were able to give.
My advice to anyone who would actually want to come on this trip, if this is something that you've ever thought about, or it's ever been something of a dream of yours to kind of travel with your profession, jump on it. It is something you kind of have to save up a bit of money for, or do a bit of fundraising. I know a lot of us did fundraising, but jump on the opportunity. It is a lot of work, and you're working quite a bit of hours, but it's a huge learning opportunity, and it's something that you'll never really get an opportunity to do again. It was amazing to actually learn from kind of the best pediatricians in the country, really. So it was amazing that Humber College gave us that opportunity to really learn in that aspect.
I just feel very blessed and fortunate that I was chosen.
Honestly, it was the greatest experience that I've had in my academic life.